COPD symptoms are very distressing.
When we approach the management of COPD symptom control, we try to maintain their quality of life and to be able to do all the activities in their normal life.
Most patients don't want to feel short of breath. They don't want to feel that COPD limits their lives in any way, because for many of them, it has a very significant impact on their ability to do even the smallest tasks like getting dressed or even eating.
And speaking about symptoms in COPD, it's very important to know that maybe the most important part of the day where patients feel their symptoms is in the morning. And this is very easy to understand because in the morning is when you make the most part of the activities of the day. You have to wash, you have to take a shower, you have to make your breakfast, you have to dress.
Patients will vary as to the time of day when their disease affects them worst. For some people it's the night, but for most people it's first thing in the morning. They get up feeling tired, their bronchodilators aren't working optimally, and they're getting out of bed. They're doing some of the most exercise they'll be doing in the daytime, which is getting up, dressing, showering, walking around, doing those things. And so getting the mornings right is a critical treatment goal.
I think symptoms in the morning are reported quite frequently among patients with COPD, and many of them report them in a negative way in terms of these symptoms have a negative impact on their lives and for some of them in their ability to interact with friends and family in a way that they would prefer to.
Patients feel morning symptoms very much, but maybe doctors are not very aware of that because we are not asking for that.
We often overlook the impact of the patient's symptoms, and we have to ask appropriate questions. And it's interesting to know when are the key points in the day when they are most affected. And if you ask them that, there are two areas which are really important. One is the first thing in the morning and one is at night. If they can get themselves going first thing in the morning, then they're not so tired. And you'll often find, for instance, when we do rehab, the reason why they can't come to rehab is it takes them so long to get going in the morning and they're so tired first thing in the morning that the day's a write-off and they just can't get out to do things. So if we can get them off to a good start, that's really important.